1995, my experience there had really got me into healthcare, and I was studying medicine in London. I was the only person with a mobile phone in my medical school. And you know how early this is, because if you look really closely at this phone, it actually tells you what it was. So it said cellular telephone on it, in case anyone said, what's that? Oh, it's a cellular telephone. Don't believe me, it says it on it, yeah? So it was quite early. Now, 2006, I launched a company that allows you to video call a doctor. It's available 24/7, charge of £35. It's very simple to use. You just register on 3G Doctor website, top up your account by £35 using any means of online payment. You create or share your personal healthcare record. We work with Microsoft on their Health Vault product on this. And you share your concerns by completing an interactive patient history taking questionnaire. After that, any additional information you can put on there, YouTube videos, websites, pharmaceutical sponsored websites, are a particular favourite. Doctor then reviews the information before consulting you, so they do any necessary research on their end, and then they video call you, and the consultation normally lasts no more than about 10 minutes. Afterwards, you can log on and you simply download, view, share, document, PDF document actually has the information you shared with the doctor, the advice they gave you. After every consult, we also do a little survey on patients, ask them is there anything they feel we could do better, what do they like, that type of stuff. So just in summary, we're selling the advice of a registered doctor 24/7. Not a replacement for a family doctor where you can get the best care, and we're not selling prescriptions. I'll make this really clear because patients in this room will be using our service in the next year when you hear about it. This happens at every conference. Someone comes up to me and says, I've got something, I'd like to talk about it. Can I use your service? Yes, you can. You know, but we're not selling prescriptions. But what we do provide is this action plan that will ensure the next move as a patient you make is the right one. And really, it's a lot of this signposting that's so critical to the opportunity here. Now, I recommend everyone here reads Escape Fire by Donald Berwick. Anyone read it? No one. Wow. So what it showed was the invention that comes across people when they're met with in a very difficult situation. So what happened here was these paratroopers were sent in to put out a fire in Montana, a forest fire, and they made the classic mistake of surrounding themselves with fire and not having an exit route to the river. So they looked to the local guy who was the local forest ranger, and he said, wait here. Got a box of matches out and lit the ground. This is with fire chasing up them. These guys thought they could run up a hill with all their kit bags. He said, no, we'll burn here. And what he did is he invented in that moment a thing called an escape fire. You burn the ground around you, the fire comes on. Because this grass is already burned, you aren't overcome by fire. Everyone thought, what an unconventional, crazy thing to do. Fire's coming, you're going to make more fire. It doesn't even sound right, does it? This is the opportunity we have. All of those people ran away, tried their best to outrun the fire, got caught down and died. This guy was the only survivor. And he did it by inventing this new way of dealing with this. This is what we have in healthcare. Everyone's aware of this. Every single talk at this event has touched on this. We have a chronic disease burden. We have a complete shift in how healthcare is done. It's no longer the cure. You go to the doctor, get a cure. It's chronic disease management. And what we have to realise at the heart of this is access is the biggest problem. And that 24/7 access and reshaping how we think we're delivering, what our product is. So the way he sums it up is that our product is healthy, healing relationships, and these can be fashioned in very new and wonderful forms when we suspend the old ways of making sense of care. And I think that's what people over the last 2 days have really been doing. We're going to hear in this discussion even more of this. What we've got in healthcare, and the reason why a lot of people coming from other industries, you'll hear some great examples over the 2 days of how other industries have evolved. We're flawed because we've got no documentation. At the heart of it is we've got malpractice as this failed solution to protect patients. So if I ask you, has anyone got a good doctor? You'll tell me things like they're accessible, they haven't been struck off, they're in good reputation. None of this is actually a gauge of how good that doctor is. And documentation is proven over and over in industry as the best way to measure the effectiveness of anything. So if it's airlines that are using these little tags, that's how you arrived here in London safely. This is what documentation in healthcare looks like right today for 6 billion individuals on the planet who can do online mobile questionnaires. And we've got to look into people like ePatient Dave and see what they're talking about, where they're saying, give me my damn data. But can you imagine the way, what I've shown you at 3G Doctor, and is being copied by the NHS and throughout practice the world over now, where the patient is writing this EHR. What if we start with a read-write approach to talking with patients? It's not our record. And this is where we're seeing patients, their experience changing. So patients spending their time reading out-of-date magazines. This is something that we've got to change. They're sitting in our clinics, wasting their time and ours. How patients are spending their time after consultations. The reason why doctors hate Google is because they're not giving patients documents and telling patients what to Google. With our consults, every patient who uses us, we try and give them at least 1 or 2 YouTube videos. When was the last time your doctor gave you a video? So the best way, I think, and I'm going to just leave with this really, is imagine you had another industry that was undocumented as healthcare. All right? So let's just say fuel in your car was a completely undocumented experience, because you'll see how unengaging we've created an industry here. So we've all done this, but imagine if we had no documentation, so we had no fuel gauge in the car. Now obviously cars in the old days didn't have fuel gauges. You tapped the can on the side and you knew how much was in there. But imagine it wasn't working. Imagine you had no idea how big your fuel tank was as well. Wow. Imagine if when you were driving along the road there was no pricing information. So you knew it was a petrol station, but you didn't know how much the petrol was in that petrol station. Well, you probably need some because you haven't got a gauge. So you'll go in there, but then there's no pricing information on the pumps either. And the octane level, the quality of the fuel, that's all uncertain as well. No octane ratings and no idea how much it costs until you see your bank statement in a month's time or 2 months' time or 6 months' time. That's how undocumented experience would be. Can you imagine how you would have no fly drive holidays, how we would have no go for a drive on a Sunday, how we'd use petrol, travel, peak oil would be a long distance history thing, because we wouldn't be using this. And that's how people would use such a product. We'd be, self-metering, we'd be using it sparingly, we wouldn't want to engage with it. And essentially that's what healthcare has. It has this major engagement problem. And it's our job to redesign it into something that people want to engage with. And that's the opportunity, I think, that's emerged out of the 2 days here. That we have people here showing you amazing talent has gone into trying to create healthcare that works in ways. So this is something we're working on with a company called Nuance. They produced a product called Siri. But can you imagine Siri if it could take a history off you like a doctor? So we're putting our questionnaire engine together with Siri to actually provide the opportunity for a patient just to give their history to their mobile phone. Other industries that have evolved are great examples, and you've heard some great things here over the last 2 days, but Rolls-Royce are selling this hot air coming out the back of this engine. These companies have evolved. This company's in Derby, it's a big industrial company. If they can do it, you smart drug companies, pharma companies can do it. And Convergence is already ahead of us. We're seeing things like mobile connectivity come into things, very basic things like smoke alarms, which for our deaf patients or our infirm patients who are in their homes can be transformational. We're seeing this is a great product that we resell into the Irish market. And we've just done a deal with a big drug company. I think it's a cracking example of how we get a step change here. This device just takes my ECG and shares it remotely with people. And the opportunity out of that for a drug company is you can screen patients. So they're giving it to GPs and cardiologists. So they do this little promotion on the Servier booth at the Irish Cardiac Society last week, annual scientific meeting, and doctors win, cardiologists win one of these devices. It's a phenomenal giveaway, but what it provides is an opportunity to pick up more AF and the opportunity for patients to use this with things like chronic heart failure or implanted devices. It's an extreme way of documenting what's actually happening and recording it. Diabetes is leading the market, and I would really recommend you also look at this product called Telcare, some of the work they've done with 40,000 patients in the US. This is a simple blood glucometer that has inside it a mobile phone. And it just means there's no documentation process, it's all automatically done. So if my mum's a diabetic, I can give my mum this, and when my mum tests, I get the results straight away on my phone. The benefit of that is that I don't have to ring my mum up to ask her what the number is. Also, my communication with her completely changes. I phone up about her well-being, not about her diabetes. So we make it an invisible step between capturing information. And one of the other things is some of the parents who are going back to school this term with a child who's got diabetes, they're waiting every day for that phone call from the school nurse saying, get down to the hospital, leave work, go to the hospital. With this device, they know when their child does takes their blood sugar reading. So quite disruptive in terms of how we move forward. There's a great video there. These slides are all on SlideShare, so you don't have to take any notes or look at this, and click through and watch that video, because it talks about the patient journeys and experiences they have. So there's where I think we're all going with this, that mobile and healthcare are converging. Mobile health and adoption is creating an experience like mobile. And everything that touches with mobile, because of its power of convergence, they call it the cannibal of cannibals in consumer technology. But what's happening is, it becomes like a mobile experience. So we don't talk about mobile music anymore, because we just do MP Spotify on our phone. It's now a mobile experience. And healthcare will eventually look like just another one of those mobile experiences. And I think that's the pinnacle of design. And I think that's where we should all be leading. One of the problems we have in trying to get doctors to prescribe this stuff and share video content and apps with patients is they have no training in this area. So one of the things I've been proactive in doing is working with the Healthcare Informatics Society of Ireland to produce a course for healthcare professionals, and that provides them a training on what Twitter is, what Facebook. Very often we go in amongst clinicians who we want to be recommending digital content to patients, and we're finding they just want to talk about what Twitter is, Facebook, what their kids' interactions on it are. And it's very, very enlightening to help these people understand this, because a lot of people think because we know how to use Facebook and stuff like that, we understand how this works. And what's happening is doctors are using this socially, but to make that step to using it at work, you need to actually take it seriously and train them. So that's an area we're working on. You might be familiar with the Healthcare Informatics Society of Ireland, but they're a part of the Irish Computer Society. The Irish Computer Society produced the European Computer Driving Licence. That's a product that's being used by 17 million citizens. A lot of people have it on their CVs. A lot of people have it as a compulsory part. And I think in healthcare IT, we have to take it seriously. Because at the moment, it's just some job someone in the hospital does. We don't really know. It's not an important job. And we actually have to take this as seriously as the people who drive the ambulances having proper training, having a proper license to drive the ambulance. Just the same way we've got to look at, given an iPad with everyone's medical records, you've got to be sufficiently trained. And at UCLA, when George Clooney came in and about 20 members of staff looked up his medical record, they realised the advantage of actually providing this training. People didn't know where the grey line was. Can I just look up this person? I was only looking him up because I wanted to see if this worked, actually. And so there's a lot of things where you've got to train people how to use this tool. It's not Facebook, it's slightly different. And I think that's really important. And I think that the most fascinating thing is farmers come in new to this, and it's got an opportunity to lead this training in their own markets. So far it's been done by vendors. So Microsoft will sell £20 million worth of kit to a hospital, and then they just chuck in a couple of trainers and they'll sort of tell you. What's happening is there's some really good opportunities here for you to be involved in the training as an impartial provider, but also because the end result is going to be this will help drive the digital engagement.